spread mechanically or biologically. By mechanically, I mean by blood-infected needle or unsterile surgical instrument. And that's where the human involvement is. But the more likely case is biological, meaning that the parasite was carried from one infected animal to another by what we call a vector. Common vectors are horseflies and ticks, with ticks being the most common.
But why did these animals need to be destroyed?
Actually, no. There's no known treatment to eradicate the disease. Tetracycline was once thought to be an effective treatment, but in fact it only temporarily eliminates the parasite from the blood, not from the full animal. So the disease returns after treatment. Once an animal is infected, it is infected for life. So sadly, the only course of action is to destroy the infected animals to prevent spreading.
Why did it take so long to diagnose this disease?
Anaplasma marginale presents with a variety of different symptoms and is often diagnosed. It takes anywhere from 2 to 12 weeks from the onset of infection until you can clinically test for the disease. This is called the presating period. Infected animals can have no clinical signs at all, or can have fever, be dehydrated, or have breathing problems. Most common symptoms are anemia, which can lead to aggression behavior due to lack of oxygen in the brain.
That's probably should have two diagnoses. What's the trick?
The only way to accurately diagnose the disease is to identify the organism using a microscope to study a stained blood smear. The blood of an infected animal will display anaplasm, which look like dark granules near the edge or margin of the cell wall of red blood cells, also shown, which would have been in this picture.
This is fascinating. Are there any other interesting facts you can tell us about the disease?
Well, unlike many other diseases, Anaplasma marginale is rarely found in cattle under a year of age. But the truly amazing thing related to anaplasmosis is that it is an organism called the rickettsia. It is not quite a bacteria and not quite a virus. It responds somewhat to tetracyclines like a bacteria, but the little buggers cause the cattle to destroy their own red blood cells like a virus. This leaves the animal in a state of severe anemia.
I'm sorry, you must have heard me say the word interesting. Tell me, are we talking about a bug here in the United States, or is it found elsewhere?
Good question. It's actually found in all 6 continents.
6 continents? I thought there were 7.
Well, I don't think there are any ruminants in Antarctica, so I left that out.
Has there been any success in controlling this disease anywhere?
Actually, Canada has a great success for many years. It has been certified as a completely free of Anaplasma marginale.
How can such a thing be proven?
Well, every 3 years, Canada tests the blood of 15,000 cattle to ensure that the disease is not present. When they do find small herds with the disease, they eliminate the herd to prevent spreading. Using that approach, along with a very strict animal import rules, including testing each animal that comes into the country, they've eliminated the disease within their borders.
This has been fascinating. As we wrap up our discussion, I just have one more thing on my mind. We keep talking about eliminating these infected animals. I'm sure that such a task is undertaken with great care and respect for the animals. Can you shed any light on how eliminating the animals is performed?
You are correct that the animals must always be treated with great care. You are correct that the animals must always be treated with great care and respect despite their disease. So determinations are only performed by certified by officers. I actually brought some video to give you a sense of just how caring these officers are to carry out their tasks.
Fantastic. That sounds like great footage. To close out our discussion, thanks for being here.
It was my pleasure.
Nice
Thanks
to
so
have
much.
you today. All right.
Those damn truckers. You know, you'd think they'd call someone to come clean this up.
That's terrible.
Whoa. The looks of her, she's been here for a while. Well, I doubt we're going to be able to move her, but we should try. You want to get that in? Give it a little push?
Really?
Yeah, we should give it a shot. Okay?
Okay.
Go ahead. Just push as hard as you can. Okay, you just
Oh, it's so nice.
just stand back. I'll take care of it. I'll take care of it. Oh, now don't look, okay? Oh, girl, your suffering's over.
Oh, it ain't always easy doing Mother Nature's work.
Oh, do you believe that?
Dr. Croc method.